Good evening. Jamaica recorded 3 additional COVID-19 deaths and 83 new cases of the virus in the last 24 hours. This brings the total number of confirmed cases on the island to 11,875 and the death toll to 276. According to the Ministry of Health and Wellness, the 3 deaths include a 63-year-old woman from St. James and an 18-year-old woman from Kingston and St. Andrew. The other death, a 56-year-old woman from St. James, was previously listed as under investigation. Of the 83 newly reported cases, there were 41 males and 42 females with ages ranging from 9 months to 86 years. The cases were recorded in Kingston and St. Andrew 19, St. James 11, Hanover 8, Westmoreland 7, Manchester 7, St. Elizabeth 7, Clarendon 6, Trelawney 4, St. Catherine 4, St. Anne 4, St. Mary 3, St. Thomas 2, and Portland 1. The country also recorded 114 recoveries, bringing the total to 8,212. Minister of Health and Wellness Dr. Christopher Tufton on the weekend met with the executives of the Jamaica Hotel and Tourist Association JHTA and the Negril Chamber of Commerce to discuss the state of community spread of COVID-19 in the western part of the island. Dr. Tufton said that the meeting was a very productive one, as it was an opportunity to share thoughts on the current COVID-19 situation in Negril and was a chance for frank conversations with key stakeholders as they stave off any further spike in COVID-19 cases in the West. In welcoming the meeting, Clifton Reeder, president of the JHTA, said that they have a common understanding between the Jamaica Hotel and Tourist Association and the Ministry of Health and Wellness as it relates to the needed steps to curtail the spread of COVID-19, and the JHTA is ready to provide the necessary support to the ministry to achieve this result. Richard Wallace, president of the Negril Chamber of Commerce, added that they have also pledged to ramp up their efforts to assist in limiting the spread of the virus. He pointed out that all hands are on deck to reduce the spread of COVID-19. He also encouraged their workers to not only observe the protocols at work, but to be ambassadors in their communities. Minister of Health and Wellness Dr. Christopher Tufton is spending the next couple of days in the Western region as he continues to meet with other key stakeholders, including the Municipal Corporation. He met with the Hanover Municipal Corporation earlier today. During the meeting, Dr. Tufton outlined that Western parishes are showing signs of concerns in the spike in COVID-19 cases. Hence, the government is today reviewing possibly tightening the restrictions in Westmoreland.
The Christmas season is a season which tempts people to engage in certain types of activities. Part of our culture or tradition. So the larger gatherings of family events, parties, and so on. Now, as I understand it, no permits have been granted for parties. And therefore, we expect that any party that is being held is in breach of the protocol and therefore subject to punitive measures from the enforcement agencies, the constabulary, of course, the primary one. And one of the things that we're going to have to do is to try and get the citizenry not to engage in these activities. And where there are deviants, we're going to have to push for action to be taken. As it stands now, Westmoreland is under pressure, and we may have to review, Prime Minister will speak to that today in the Parliament, the restrictions in that parish, and may have to tighten those restrictions. And we, if as a government, we have to consider that for all concerned if we think that the numbers are getting beyond what they ought to be. Now, I raise that as the context to say the parish of Hanover, which is, of course, next door, has the potential for spillover if, because of the way we move as a people. There are many workers who reside in one parish who travel to the next. The tourism belt is a continuum. on the Niggerville stretch, for example. And the same could be said for St. James, Trelawney, I mean the entire stretch through to St. Anne. The data on the ground is suggesting that all these parishes along that stretch are showing signs of concerns in terms of the numbers.
Medical Officer of Health for Hanover, Dr. Kaushal Singh, in addressing the council today, pointed out that there is a little of over 270 cases of COVID-19 in total recorded in the parish, with 30 of those cases currently active.
By the end of this evening, our tally will go above 270. Out of these 264 that till morning, 29 cases are active, and our active clusters are in two communities. One is the Lucy East, a specific one is in Q. So there are two areas where we are having active clusters. As far as responses, this is the overall situation. If you look at our population, it is 72,000. And if you try to put this as a denominator for that, then you find that our cases are quite high. For last 4 months, we did more than 1,455 tests. And that gives us a positivity of 17.6. So this is the positivity rate. Slight comfort at this level, we have only 3 deaths reported in the parish, which is linked to COVID. Two were coincidental, one were direct related to COVID. For testing for because the recent past, last 2 weeks, we have quite increased number of cases. So we did at least 6 outreach. Every Friday we are doing testing at Lucy Bus Park, and we did at Hopewell Transport Center, we did Orange Bay, and apart from this outreach, our public health residential facilities will be also visited very frequently, and we tested our resident in infirmary, nursing homes, inmates in prison, and for our consolation is that all came negative.
Additionally, Mayor of Lucy, Councillor Sheridan Samuels, announced that following the vote in the council today, the Grand Market will be postponed due to the rise in COVID-19 cases.
Scale down our Christmas tree lighting and all those things, where we are not going to have any function. We are just going to light the tree, just to, bring back some semblance of Christmas within the parish itself. But if we are responsible, we have to take the hard and harsh decision. I am not hiding from taking it, but I believe in democracy, and that is why I called upon the other members to state their claims. So officially, we are calling here in Hanover for Grand Market to be on hold and suspended, so that persons or citizens can be safe. And for 2021, in the second quarter, you have said, or third quarter, you have said where we can get the vaccine, that will make a difference.
Meanwhile, the minister also toured the town of Lucy on a public education initiative to sensitize members of the public about the infection prevention and control measures to be observed, even more so as the holiday season approaches. In his charge to the public, Dr. Tufton urged persons to wear a mask even as they find it difficult to always practice social distancing.
You were the last parish to get a COVID case, but since that, you have well over 250 cases of COVID in the parish of Hanover. You have nearly 30 active cases currently. A number of people have gotten better, and we give thanks to the health team for that. I know it's not so easy to physical distance, especially when you're in the town, when you're in the taxi, when you're in the bus, because space don't allow the 6 feet apart. So I'm going to be practical and recognize that even in the festive season you might have it even more difficult to physically distance. But every single citizen can wear a mask. And the mask to me is something that nobody should ignore. In fact, I keep telling everybody that the mask must be a part of your clothes. When you leave your yard to go out, you either have on a shirt and a pants, a blouse and a skirt, or a dress. Am I right or wrong? You have on other things too, but we are talking about the basic necessities. Right? Your mask must be a part of your dress if you want to protect yourself from COVID. And so I say to all the citizens of Hanover, COVID is around there, it's down there, it is at your doorstep if you're not careful. Protect yourself, protect your family, protect your community this holiday season.
For his part, Mayor Samuels urged residents of Hanover to desist from having illegal parties and strictly adhere to the protocols put in place by the government to help prevent and stop the spread of COVID-19.
Remember again, Hanover, I'm pleading to you, I'm charging you to maintain the protocols. Those illegal parties that we are having, those grave diggings that we are doing out there, we don't want to have them anymore. We know we have to go to funerals, but there's a protocol layout for funerals. So you try and maintain those things. We don't want to have much funerals, you know. We don't want to have that. And if we constantly going around driving in vehicles and don't respect the protocol, we are going to get sick. Actually, all agencies in this parish have a positive case of COVID. I can report to you that our administrative building there, we just identified one case. Our infirmary, there were 2 cases there. I know that the police have the experience too. I know that the tax office have the experience too. I know that the NIS have the experience. So COVID is among all of us now.
In the meantime, residents in Westmoreland reacted to the spike in COVID-19 cases in the parish.
Boy, the corona get dread now, you know. So, boy, I want to know wear no mask, you know, because it have broke out bad down here, you know. All the people them about here, I catch it now. So, boy, I want to know buy, get a mask, can get it. If you never want me, we give one for me have there. Because I buy about 8 of them, and we give no one, you know. So, only just get no mask, you know, Rasta. And sanitize yourself, you know. When you not do it, all the money we take from people now, to sanitize on the hand. That's why nothing wrong with it. And more everybody to have their mask. Because all me, you know, all cripple, you know, should make it stroke, so me have to have my mask. So I want everybody have their mask.
They now follow the protocol right here in Westmoreland. We mind wearing their masks, wash their hands, and take proper precautions. You understand? When you're going in places, when you're going in taxis, wherever you go, you just wear your mask and sanitize your hand. If they don't have sanitizer, you walk with your own sanitizer and make sure you sanitize your hand after touching, or you go somewhere, you just sanitize as you go. Some people say, boy, corona is not real, but I can tell you this is real. So as you go, just follow the protocol, and watch the social medias and the radio, TV. Follow the ads. Wash your hands, sanitize your hand as you go. You understand? You don't, basically, sometimes you go, you don't know who have it. So you just have to do what you got to do.
My name is Never Myers, otherwise called Chop, you know. But the thing I go on, you know, we have to just wear a mask and keep the social distance beard. That's the only thing we see I go on in our town. It's a smaller town. We have down here, so and if we not keep the social distance and wear the mask, we don't have more problems. So you have to practice, wash your hands, wear your mask, and do the right thing, and see if we can cut down this virus.
One business operator in the parish, Melvin Honeygan, owner and managing director of Honeygan's Funeral Home and West Palm Memorial Gardens in Savannah Lamar, explained that in having to deal with COVID-19 deaths, being prepared is vital in dealing with the spread of the virus.
There is a rise, but I don't think we should start at the top of the ladder. We should first start on where did this thing started. Because bear in mind, when we were talking earlier about COVID that started in March, if you remember clearly, I said we were not able to handle these COVID cases because we had no equipment to handle these cases. We were not advised and we did not know what to expect. Because when Ebola was coming, the then Fenton Ferguson, Minister of Health, had a meeting with us as funeral directors, and we made a decision how the thing would be treated. This trip, we were not informed, but now, based on time, I now have equipment that we can use to dress our members properly to handle these cases. At present, we have at least 6 bodies that is COVID suspected cases in our care. 1 is from Hanover and all other 6 is from Westmoreland. But we need to bear in mind that we know we ought not to mix COVID suspected cases with non-COVID cases. So we have to have proper arrangement of how we're doing it. So at present, we store these bodies in a different cold room from what the other bodies are stored in.
He further explained how the process has been for him and offered some advice to health authorities in the western parishes.
Since we recognize that we have no document to receive, whenever we get a call, we would ask the family member, what do you think was the cause of death? And some of them will say to us, he or she was brought in suspected for COVID, but the result did not come back or the result come back. So based on that, once there's a suspicion, we treat the body as a COVID case. Now, it's important to know, I think that the public health should by now recognize that if we are treating the virus in a manner, we must treat it from start to finish. And if we are the first caller at the time of death, it is very, very important for us to see documents to prove that yes, this is a COVID case or this is not a COVID case. And I pull my example. There are, let's use 2 common cases that nobody don't have to tell you. You can identify for yourself if you are such an advanced funeral director. Let us look at a normal person dying and a person dying from jaundice. It requires special treatment of chemical for a jaundice different from the one that died naturally. Because the jaundice case, if you put in improper chemical in that remains, the body turns green. And we like to know, just like how the medical practitioner wouldn't like to know exactly that they give the person the right injection, we like to know that we place the right chemical in. And also, we are being protected by knowledge.
He said his team at the company is prepared to handle any situation arising from the spread of the virus in the region.
I would say I'm at least 95% ready for whatever is happening. The most important thing to us right now at Honeygan's is that we are informed before we go to pick up these remains, because we have to dress in a certain manner, and that the first remains we pick up at Cornwall Regional, that was a COVID case. I gave the guys bag to put the garments that they got to wear when they get to the hospital. But fortunately, when they had finished picked up, the hospital fumigate them and take those garments and dispose of them. I have to protect my staff because what we need to recognize is that the same staff you don't protect can bring the virus to you. And I told people that let's talk about the first thing we were talking about as disease that most people did not like was HIV. And I think more or less that we should not treat anybody with any form of disease or virus with scornful natures because they will find a way to give it to you.
In other news, the Ministry of Local Government and Rural Development has listed 16 beaches and 19 rivers that are to remain closed in an effort to contain the spread of the COVID-19 virus on the island. The list includes beaches and rivers in Kingston and St. Andrew, St. Catherine, Clarendon, Manchester, St. Elizabeth, Westmoreland, Trelawney, St. Anne, Portland, St. Mary, and St. Thomas. Under the latest disaster risk enforcement measures over the period December 1 to January 15, 2021, public beaches and rivers, with the exception of the aforementioned facilities, may open during the hours 6 a.m. to 6 p.m. The Kingston West Police are seeking the public's assistance to find the parents of a newborn baby girl who was found abandoned in the Coronation Market in downtown Kingston yesterday. Reports are that at about 7 p.m. a homeless man saw the baby in the market and raised an alarm. The police responded and the child was taken to the Bustamante Hospital for Children. Anyone with information is asked to call the Denham Town Police at 876-922-6441 or 876-948-6443, Police 119 emergency number, or the nearest police station. The Jamaica Constabulary Force JCF says their joint operation with the Jamaica Defense Force JDF has resulted in 4 firearms and 40 rounds of ammunition seized over the last 24 hours. 5 men have been arrested and 1 fatally shot during one of the operations. In one of the operations, 1 man was arrested and charged following the seizure of a .380 pistol and 14 rounds of ammunition at the Oxford Mall in downtown Kingston yesterday. In other news, if Deputy Mayor of Montego Bay, Councillor Richard Vernon, should have his way, the local authority in the Western City will be asked to rename the River Bay Road in honor of one of Western Jamaica's most prolific and outstanding youth development administrators. Vernon, who is the councillor for the Montego Bay South Division, is championing a campaign through the Montego Bay Municipal Corporation for the River Bay Road to be renamed the Gladstone Pop Lawrence Avenue. Mr. Lawrence has been the administrator for the landmarked Montego Bay Boys and Girls Club located on River Bay Road in the Western City for close to 60 years, which has developed a reputation for being the home to many inner-city youths. Among Mr. Lawrence's achievements over the years is the formation of the Montego Bay Boys Club Marching Band in 1961, the Boys Club football team in 1957, and the first all-girls band in the Caribbean in 1964. Deputy Mayor Vernon argued that the renaming of the River Bay Road would be a befitting honor to be bestowed upon Gladstone Pop Lawrence in recognition of his work and contribution to the city of Montego Bay. Mr. Vernon noted that he will be sending a resolution to the Ministry of Local Government to seek the ministry's support in having the River Bay Road renamed in his honor. And finally, People's National Party President and leader of the opposition, Mark Golding, yesterday launched the O.T. Fairclough Trust Fund for party workers at the PNP headquarters in Kingston. The fund is one of the initiatives Mr. Golding had promised to deliver during his first 90 days as president, and this will see the People's National Party giving back to those who had dedicated their time and efforts to building the party. The main beneficiaries of the fund are noted to be long-standing party workers who are in need of assistance. The fund has been named after the PNP's founding father, Osmond Theodore Fairclough, who was a radical leader in the 1930s and is responsible for the ideological structure of the PNP. The fund was named after him in recognition of his distinguished contribution to the party and country. Yesterday's event was attended by 5 trustees: Mr. Burchell Whiteman, Mr. Peter Reed, Miss Catherine Casserly, Miss Norman Grant, and Miss Keisha Anderson, who currently serves as party treasurer. And those are the stories making news. I am Tamar McHale. We will now take a break and then join Christopher Scott with sports.